Life expectancy in the United States has fallen over the last couple of years thanks to COVID taking the lives of over 1 million Americans. OECD countries' life expectancy sits around 80.4 years, while the United States life expectancy was found at about 77 years. The United States maternal mortality rate is 23.8 deaths for every 100,000 births, which is 3 times the rate of other higher income nations. On top of that, 5.4 infant deaths per 1,000 births puts the United States infant mortality rate as the highest of all OECD countries. The authors of the study cite poor prenatal care, high rate of C-sections, and poverty for low life expectancy. The last reason contributes to chronic illnesses like obesity, diabetes, and heart disease. 40% of Americans can't afford a $400 emergency, so how could they ever afford prices for even normal preventative health care, let alone an emergency? What could be the reasoning for this vast difference in life expectancy? Maybe it's the fact that all other OECD countries provide universal healthcare and don't believe a person's healthcare should be something that should be profited from. A pretty simple solution would be to enact a single-payer Medicare For All system within the United States because Medicare is the most popular healthcare insurance in the country and provides adequate healthcare for its recipients. The United States has 8.6% of its population without some kind of health insurance and 24% of the population without adequate health care coverage. Providing Medicare for All would prevent roughly 68,000 deaths per year. Researchers acknowledge that this number is a conservative estimate because it doesn't factor in the lives that will be saved for those that have postponed or foregone care because they couldn't afford copays and deductibles. With this policy, Americans will have the freedom to choose any doctor and/or hospital and avoid in-network or out-of-network bullshit, losing critical time. Doctors can focus on the medicine rather than hospital administrators hounding them to push pricier and optional procedures to increase hospital or network's profits. All necessary procedures and exams will be covered under this plan, as well as the inclusion of vision and dental. Vision and dental must be included because oral hygiene and oral healthcare is a key component amongst preventative healthcare. Preventative care will lead to less expensive and invasive healthcare because diseases and illnesses will be spotted before they get out of control. Think about it. Is it better to take your car in when you initially feel some grinding with your brakes, maybe hear a squeak here or there? Or should you just wait until the brakes deteriorate further and your entire housing needs to be replaced? The very obvious answer is to take care of it as soon as possible to save money and time. Why should we not be able to do the same thing for our healthcare? Because of embargoes in Cuba, Cuba's healthcare system has focused on preventative care because of lack of resources. Cuba has a higher life expectancy and better health outcomes than the United States. On top of that, Cuba believes they've created a vaccine to eliminate lung cancer, but the embargoes put on them by the United States prevents Cuba from providing this to other countries. I'm sure I'll make a video on this later down the line. Medicare for All not only provides the freedom to choose their healthcare provider, but it also provides Americans the freedom to leave a job where they are miserable and pursue something that they are passionate about. This could lead to creations of new jobs, business, or even industry without fear of losing their healthcare and thus encouraging economic innovation. Employers would no longer need to pay for premiums for their employees or waste time and resources on seeking better healthcare for their employees, if they even provide that. Healthy workers would lead to an increase in production for employers. Why has the United States not joined every other wealthy country and provide medical coverage for all its residents? Another benefit for Medicare for All would be the removal of healthcare coverage off the negotiating table with employers for wages and benefits. This provides more leverage for workers to negotiate better wages. The power to negotiate wages is vitally important because the wages in the United States have stalled in the last 40 years. Until that time, production and wages within the country rose simultaneously during the policies enacted within the New Deal. After the beginning of the dismantling of the New Deal, production and wages diverged, resulting in wages flattening and production continuing to rise. That's another video I'm going to make down the line. With all those benefits of universal healthcare, what are the downsides? Funny thing is, those who oppose it do not really have any footing. Bad faith actors will even bring up, how will we pay for it? I'm glad that you brought that up. The United States spends more money on healthcare than any other country, and Americans receive worse outcomes for it. A study was done comparing 22 different single-payer plans over the last 30 years. All of these studies showed that the United States would save money on its healthcare if they would implement a single-payer system. That funding can then be used for schools, infrastructure, and research and development for new innovations. According to the study done by Yale researchers, the United States would save $450 billion each year and $2,400 in annual savings for the average American family. These savings could be put towards a house, retirement, or some kind of experience like travel or pursuing a different career. In fact, one of those studies conducted for the purpose of showing that Medicare for All would be more expensive actually showed the opposite. Saving money is just one of the many reasons to adopt this policy, but the most important part is that millions of Americans will finally have an opportunity to take care of themselves. Proposals state that there may be a 4% tax on income implemented to supplement funding while the wealthy attempt to avoid paying their fair share in taxes. Yes, that does make it seem like there will be less money in American pockets. However, the premiums we pay every month for inadequate healthcare coverage is a tax itself. Okay, let's do a little math. I'm currently working a seasonal job where most of my income is only made in a handful of months. I'm currently single, and so I'm the only one that I have to pay for my medical insurance for, while families have to pay for their kids and spouses. The best month, I will be making $7,200 for that particular month. This means that I'm likely going to make less than $7,200 for the rest of the months. So again, this is the most that I will make in one month. My monthly medical insurance payments is $364, and my dental monthly payment is $23.13 per month. That's a total of $387.13 for each month. My insurance does not cover anywhere near as much as what Medicare for All would cover, including dental and vision. So, $387.13 divided by $7,200 times 100% is equal to 5.38%. So, if I would pay a 4% tax to cover all my medical expenses, including vision, dental, and mental health, I'd save at least 1.38% on my best month. So all the other months where I'm not making that $7,200 a month, I'd be saving even more. That savings doesn't even account for my copays and deductibles I would have to pay if I'd actually seek any medical assistance. So if that's all the savings that I would currently have, what about all the hardworking families who would have their medical expenses covered? Typical working family pays $5,277 in premiums through private health insurance companies. With this policy enacted, a typical family of four making $50,000 per year would pay just $844 for a year's worth of medical coverage. This would be a savings of $4,400. If you're still really concerned with how it will be funded, I've included a proposal to provide adequate funding for Medicare for All. It is all a no-brainer to me to contribute 4 pennies for every dollar I make to ensure every person in the United States has adequate healthcare coverage. Now you may ask, wouldn't this mean doctors' income would immediately drop? I'm going to let a guest for Fox Business answer that for you.
The salaries of doctors in America is higher than everywhere else. How do you reduce that salary to levels of other countries to make this work?
Frankly, you could move to a single-payer system in an affordable way and still pay doctors roughly comparable to what they're being paid now. The biggest savings in moving to a single-payer healthcare system is in eliminating, or rather reducing, the enormous amount of waste in our health insurance industry. That's the biggest source of savings. And the second biggest source of savings is, as you said, high pharmaceutical costs.
If the hospitals go out of business, the doctors all just no longer work because they're not getting paid below market rates. It says we'll cut their pay by over 40%. I mean, then where are you going for care if that happens?
Many nations have done this. None of them have had their hospitals close or their doctors.
As you heard from the doctor, it's not the case at all. There'll be a huge reduction in the large amount of waste within the health insurance industry. This includes bloated executive salaries and hospitals' administrative costs from tangling with insurance companies, as well as the enormous price pharmaceutical companies have been gouging Americans for years. These will be the biggest savings with the implementation of a single-payer healthcare system. Be sure to watch the rest of that video. I'll include a link in the description below. The doctor thoroughly dismantles every single bad faith talking point the business panel throws at him, so much so that the business panel tries to speak over him throughout when he's making clear, concise, factually correct statements. Touch on a few of the bad faith arguments against universal healthcare within the United States. This current affairs article touches on a few more and swiftly debunks the arguments. I'll be sure to place the link in the description. All of my opinions have been formed after thorough research and debunking. If you do follow up and do further research, be sure to make note of the source and ask yourself, what's this source's motivation? If you're reading a corporate media article, they may be against anything that will be funded through righteously raising taxes on corporations. If it's an opinion piece opposing universal healthcare, they might be throwing shit at a wall and hoping something sticks because they're funded by the very people that are against it. I am going to continue to fight for what's right and vote for representatives that will get this policy passed. Our current system only does what's best for the wealthiest among us. Doing what's best for all of us will lead to the best possible outcomes.